A lot of people have asked whether or not the new health care bill increases our nation's debt, and the good news is in the first 10 years since it's following its passage, the debt actually goes down by about roughly $140 billion. Even better news is for the second 10 years, the national debt is expected to go down by roughly another $1.2 trillion. So the Congressional Budget Office, which is neither Democrat nor Republican, it's nonpartisan, says that we can look for roughly $1.3 trillion of deficit reduction over the next 20 years, most of it in the second 20 years, to help reduce the budget deficit rather than to increase it. There are a number of benefits that kick in right away. There are others that kick in 2011, and some of the really big ones kick in 2014. But in terms of things that are meaningful in 2011, there are a number of young people under the age of 18 who have a pre-existing condition. They're being denied coverage because of those pre-existing conditions. They lose their health care coverage. If they lose it, they're unable to get it again. Young people under the age of 18 will not be denied access to health care because of pre-existing condition. That's a big one. Young people, young adults who've come out of school or graduated from school, they're 22, 23, 24, 25 years old, they'll be able to continue to get coverage under their health insurance plan of their parents up to their 26th birthday. And finally, they have folks that are Medicare eligible who are participating in the Medicare prescription drug plan. They'll begin, the donut hole is going to begin closing for them this year. Next year it'll close in a big time way. And I think those are three immediate deliverables under the bill this year. A number of people have been concerned about losing their Medicare benefits. Actually, three, I think, very positive things that happen under the legislation. Rather than losing benefits, these are pluses. One, for folks that use Medicare Part D, the prescription drug program, this donut hole that concerns a lot of people whose drug costs reach a certain level. We're going to begin closing the drug hole this year, continue to close it over the next 10 years, but this year and next year make a big move toward reducing the size of the donut hole for folks. Second thing that I think is a great benefit for folks, currently when they reach age 65 in Medicare, they're eligible for one annual physical paid for by Medicare for the rest of their life. That's it, one. Under the legislation that we've passed, folks who become Medicare eligible can receive every year of their life, for the rest of their life, an annual physical. If they live to be 105, that means they're eligible for 40 of them, and these physicals will include cognitive screening as well. And the last thing that I think is a real plus is there's a lot of Medicare fraud going on. We're expecting, it's really draining the Medicare trust fund in a big time way. The life expectancy of the Medicare trust fund was down to about 8 years just a few months ago. Now we've extended it to 25 years, in part by going after the fraud and recovering money. I know some folks have been concerned that what we're doing is a government takeover. A friend of mine who worked for Republican Senator Olympia Snow from Maine on the health care bill, but a staff person, he said after the bill passed that was enacted and signed into law by the president, it actually what we passed looked actually a good deal like what the Republicans offered as an alternative to Clinton care in 1993 and 94. What we're trying to do here is to focus on what works to reduce health care costs and to improve outcomes. And it's not a government takeover, not government run, government funded. That's what they do in England. It's basically figuring out what works, large purchasing pools, be able to bring down administrative costs as a percentage of premiums, trying to make sure that people have access to medicines that will help them get better, and trying to encourage, incentivize people to really take control of their own lives and to actually do some things in terms of personal responsibility that will help make them healthier. Yeah, in one of our telephone town hall meetings, a fellow said to me, we had thousands of people on these telephone town hall meetings, and we'll do some more. People just seek to learn what's in this legislation that we've passed. One fellow said to me, he said, if this is such a great thing that you're doing in creating exchanges, which are large purchasing pools in all 50 states by 2014, where individuals and families and small businesses can come to the exchange, buy their health care coverage over the internet, use a large purchasing pool, drive down health care costs. He said to me, if this is such a good deal, Senator Carper, why don't you get your health insurance through the exchange? And they said, under the law, I have to, when the exchanges stood up and opened for business in 2014. So then he said, well, how about your staff? And I said, well, my staff is required by the law to get their health insurance through the exchanges as well when they were stood up in 2014. And the idea is to take what works, to replicate what works, create large purchasing pools, offer a wide variety of choices, including the kind of coverage that we now get as members of Congress and federal employees, drive down premiums by lowering administrative costs. Those are some of the things that will happen under the legislation that we passed.